Welcome to the Reprofiles, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Reprofiles.
Infertility, injustice, and all things nobody warned you about.
So, hello everybody. This is Anne Marie from the Repro Files coming back at you, and we're talking with Steph Herold. And Steph is going to be talking to us today about abortion and in the media. So we welcome you, Steph. Steph, can you tell us a little bit about yourself and a little bit about the work that you do?
I'm a researcher. I study how abortion is depicted on TV and film at an organization called ANSWER, which stands for Advancing New Standards in Reproductive Health, out of the University of California, San Francisco. So I study how abortion is portrayed in TV shows, what it tells us about abortion in popular culture, what it tells us about how people think and feel about abortion, what people take away from the show after they watch, and also what the trends are generally and how it does or doesn't relate to what's going on in the abortion policy landscape.
I know that through the years, just watching TV in general and watching movies, it is a lot in like medical dramas, medical shows. It is always addressed. I don't know if you have watched The Pit. There was an arc in there as well, a story. So what do you think about them portraying abortion in TV shows and movies, and how realistic do you think it is?
Yeah, it's a good question. And I think it's a really mixed bag. And I think TV writers are really trying to balance a lot of things, right? They want it to be really good TV and they want it to be dramatic and interesting to watch. At the same time, they're trying to tell a story that's a little bit different than what they think they've seen before. So they want it to be interesting and they also want it to be good TV to watch, right? So they may not necessarily be thinking like a researcher or like a clinician and about the power of seeing something on TV that may not be factually accurate, right? I think all of us are pretty aware of how misinformation can spread so quickly these days, especially, from TV to social media, and then it's kind of the conversation has totally spiraled. So I think there are a couple of things on TV that are accurate. When we see abortion on TV these days, it most often is portrayed as a safe abortion. So it used to be not so long ago that abortion on TV and film was portrayed as much riskier than it is in real life. You are much more likely to see a character die from having an abortion, and we don't see that these days, right? It seems like the message has gotten through to Hollywood that abortion is one of the safest medical procedures that a person can have. So, unless the show is set in a time period in which abortion was, those are the kinds of shows that may still frequently have a character who has a bad medical complication from an abortion. But these days, mostly abortion is shown as a safe procedure that it is. Now, when I say that, and at the same time, there are some shows like Law and Order, for example, that like to really dramatize abortion risk. And we know those shows rely on this kind of case of the week example where there has to be
Hmm.
something really drastic and terrible happening, right? So sometimes they'll have, a character will have taken medication abortion pills and she'll be bleeding out on the street, right? We know that
Hmm.
that doesn't actually happen, but it might, influence viewers to think that it's very unsafe. So it's a balance in terms of
Yeah.
what's out there.
Yeah, I think that, I think about the media that I've seen when I think about abortion, and I think about media. I'm a film buff, so I really watch a lot of movies. So I think of like Dirty Dancing, right? That was a big thing. And that was a medical complication because it was set in what, the 50s, 60s when it was set, when it was illegal. So there was a bad outcome. But then it turned out to be everything was fine. She's going to be able to have children in the future. But I also thought it was really interesting that with that film, nobody thinks about that part of the movie, right? They don't think about like Dirty Dancing associated as an abortion film. But I mean, the premise of her doing the dirty dancing, right, was because of the loss of the partner, right? That's a whole
Right.
thing. So I think that's an interesting way to kind of like that they got it in there. The other thing that the other movie that was big that I watched as a younger person, Fast Times at Ridgemont High. They had the character. she's young, and the boyfriend doesn't even show up. Like he said he was going to be there, he's going to pay for it, and all that, and he doesn't even show up. So that I think was, she went there, and I think that happens, more often than not. Maybe, I don't know. I did work at Planned Parenthood, so I would see many partners come with, the women to have the abortion. Some of them are very caring, and others of them literally played video games on their phone during the procedure. So, those are the ones I just kind of wanted to slap upside the head and be like, yo, can you hold her hand or something? But I think you're right about the time period things. Again, those are films from older times. And also Call the Midwife is another one that I watched a lot, right?
Right.
That whole storyline of having the essentially back out abortions, right? They were doing them illegally and not by professionals. It wasn't safe. And that's how the whole storyline of getting it legalized in the UK came about. So I thought that was a very interesting storyline in that show. And I really like that show because they show all the different aspects of it, particularly, and I forgot the nurse's name, but the blonde, and she was the one that witnessed it, and she's the one that brought it forth, and but yet she was still like, everybody should have that right to make that decision, and it should be safe. So it is concerning nowadays that people kind of want to take that right of choice away from people, but then we're going to be going back to where we were before, right? And I think, yes, we are portraying safe abortions, and that's a good message, but I think sometimes people miss that this is what was happening before Roe, right? There were these people that would come into town and they would do these things in unsanitary conditions and they weren't safe. So I don't know, if doing more of a time period piece, maybe that should show people where we were before. What are your thoughts on that?
Yeah, it's a good question. I think it's Nurse Trixie. I'm
Yeah.
remembering.
Oh,
Maybe that's her
yes.
name.
Yeah. Yeah. Yes.
I really like that show too. Although I didn't like watching it so much after I had kids because I did not want to relive childbirth, but yes, that what really struck me about that storyline and one trope that I think has really been exaggerated and overdone on TV is this theme of the back alley abortion provider. Like, I think this trope has really done a lot more damage than good, and
Mhm.
it really misses a lot of the stories of the dozens of clinicians who were providing safe illegal abortions. There was recently, a documentary and also a feature film about the Jane Collective, right? About this group of women who taught themselves how to provide abortions and were doing thousands of safe abortions in Chicago before it was legal. So I think that there's this I don't think what people take away from those storylines is, wow, how bad it used to be, even though obviously there were tons of those horrific examples at the time. And there were also lots of examples of safe illegal abortions. My guess is what people take away is, wow, abortion is dangerous, period. And they don't
Mhm.
kind of absorb the context of the time period. So I hesitate to say we need more of those. I think we've kind of exhausted the gamut of that stereotype of the back alley abortion provider. I think it also just does a disservice to providers, right? Like the illegal abortion provider is often portrayed as someone who's taking advantage of patients, who's just doing it
Mhm.
for money, who doesn't care about safety. Even in Call the Midwife, when I think it's like this grandma who's doing it,
Mhm.
who's kind of like a lovable character, right? Her office is really dirty and there's lots of blood everywhere. The instruments aren't clean. And, I think we could all conjure up that image in our mind of what, even if you haven't seen the show, right? We've all seen some version of that. I would love to see, to be honest with you, like I would love to see more fantastical abortions, like imagining what abortion could look like in the future, like even sci-fi. Like if we applied the kind of cool technology that you think of in so many different other types of shows, like is there some way to have a futuristic cool abortion? That's what I would want to see, just imagining it to be something much different than it could be,
I
much
like
different
that.
than it is.
I do like that. I think that you're right, that we do see that the horrible, "Oh my gosh, it was all horrible." You're right. There were many doctors and providers that were actually doing that, and that's a really good point that you brought up, and then I think you're right. I think we should focus on that as, showing that, hey, there were people that were actually doing this in a very safe way prior to Roe as well. And I adore the sci-fi because I'm a big sci-fi person. So, yeah, I'm all on board for, yeah, let's see what the future, or, can sci-fi, sometimes real life is imagery in sci-fi in the past, right? Cell phones, iPads, things like that. Yeah, why can't we have that imagination? You're right. I do like that a lot. So the other thing, one of the things that I noticed, working in a clinic that I don't see a lot in the media when I watch TV shows. And when I watch shows, it's a lot of times it's the teenager or the college student. In my experience and what I saw in the clinic was majority of my patients were older and already had children. And I know there's a statistic that was like something around 59% of people who are having abortion actually already have children. Like, I have helped people who they have children, they love their children, they just cannot take on anymore. And that's the reason why we're there. So that would be something I think that a lot of shows, movies, something to show that line, because majority of the patients already have children.
Yeah, and I think that's something we so rarely see on TV.
Mhm.
Year after year, no matter how much other things might change, we found that, I think it's like 59% of people who have abortions are already raising children. And on TV, even the last year, it was 8% of characters who had abortions were shown as parenting. The year before, I mean, it just has been so low, below 10%, at least for the last decade that I've been doing this work. I think there's this idea, this really nefarious idea, that people who parent and people who have abortions are two different types of people, when in reality, right, we know that abortion and parenting really go together and are part of the same person's life at all different points of their life, right? And I think another piece that stands out is a lot of the characters we see on TV are white. Right there, it's usually a white teenager having an abortion. That's kind of like a common trope that we see, well, in movies as well. And we also know that it's most common for abortion patients to be people of color. So it's another big missed opportunity on screen, is to show that experience and really to explore how racism is baked into the healthcare system, how abortion restrictions disproportionately impact parents, disproportionately impact people of color, disproportionately impact people who are struggling to make ends meet. All of that, I think, to me, could make for very good TV, but we really don't see a lot of that on screen.
Why what do you think is holding back people from those types of stories? Like, what do you think is holding back directors and the writers from doing that?
From the limited experience I've had talking to TV writers, it really doesn't seem like it seems like they do really want to tell these stories, right? There are a lot
Mhm,
of people out there who've written scripts for abortion workplace dramas, right? Who've
mhm,
written all these amazing sounding scripts that focus entirely on abortion, right? But networks and studios are afraid to make them. I think because there's this sense that abortion is a bummer, that no one is going to tune in. It's not something that people will want to watch week after week, that it's something that you have not even a main character, like a one-off character come in. It's about one plot line on one episode. It's not something you touch for a whole season of TV. It's very rare for that to happen. So I think there's a sense that American audiences won't tune in for something like this. And the reality is that my colleague Vicky Szabo has done this incredible research that we published together about how audiences actually do want to see storylines about caretaking, about work and family life, about characters thinking about if, when, and how to have children. Like, audiences primarily support abortion rights. So I think there's
mhm,
this idea from networks or studios that people wouldn't watch or people would boycott. That's just
mhm.
not the case. People want these storylines. They want to see characters struggling with these things in a way that reflects people's real lives and experiences.
Yeah, I think so too. I think it is a missed opportunity. I think working in the clinic, like, I could have written many episodes, of just being in the clinic just to, take people out of their comfort zone, sure, but also kind of showing a different way and how people are making these decisions and why they're making their decisions, not just, oh, again, I've encountered protesters and, the shouting and all of that. I have been part of the receiving end of that. I can't imagine being the receiving end if I was a patient. As a worker, I was just kind of like we weren't allowed to actually engage. So we weren't even allowed to like look at them. So that was really hard because I really wanted to give them dirty looks. But but I think, being from the patient, I think there's a lot more that people don't understand about it, and getting that message out and being able to portray stories like that is a very good opportunity in the media as far as like TV and movies and things like that go. When I do see something on a show, like for example, we were talking about, I mentioned the pit earlier when they had the abortion. One of the things I was like, why is she in the ER doing this? And, obviously every state is a little bit different, but I was kind of like, why is she in the ER? Like, did they want to just put this in? And I was like, why is she coming? I was very confused about that. So in that aspect, I was kinda like, "Is that really how it works? Do people go to the ER to do that?" And that's not my experience of seeing that, so I thought that they needed to get a storyline in, I don't know, but, I was kinda like, I think a more clinic-based show would be really good, like a I don't know. You could write so many stories about clinics, primary care physicians, I mean, you could do it all, by an office.
Yes,
So
1,000%,
yeah,
1,000%, and there have been some shows that have done it, like Private Practice, the Grey's Anatomy spinoff.
okay.
They had a couple of abortion episodes on that because their main character, wanna say her name is Dr. Addison, I think
Uh-huh.
that's right, um, is an abortion provider and kind of comes back on Grey's Anatomy every so often to do abortion provision related episodes. Mindy Kaling had a show, I forget what it's called now, that was all about a GYN practice, but she kind
Mhm,
of famously said that abortion isn't funny and her show would not be tackling it. And then ironically, after that, there were a couple of years of many different comedic shows tackling abortion, from Jane the Virgin to
mhm,
BoJack Horseman. It was around 2016. Now aging myself, but abortion has Veep also. Many different comedies have found ways to tackle abortion
mhm,
um, that have, at least to me, been totally hilarious and amazing. Where the joke is actually on abortion restrictions and how ridiculous they are, or on the protesters. And I think it's been a great way to give some depth and some context to abortion decision making and abortion experiences instead of making it kind of like a one note experience that you see on
mhm,
TV, right? It doesn't
mhm,
have to be a tragedy. It can be for some people, but obviously
mhm.
doesn't have to be for everybody.
Right,
And showing
right.
the breadth of those experiences, I think, is really important.
So it's funny because you're saying all I don't watch, like, all of the shows that you mentioned. I know of them, I kinda know about them, but do you watch a lot of TV? Like, with this research, do you have to watch a lot of TV? Because 'Cause I'm like, "Man, maybe I should get into this field."
It sounds more fun than it is
Mhm,
because I mean, it is fun to be able to say, like, yes, I need to watch TV for work, but
mhm,
then watching any TV feels like work, so it's kind of
mhm,
a a balance. But yeah, I really do have to try to stay on top of what are the hit shows right now, and I think because I've been doing this work for a while, I have kind of a sixth sense of if a show may have a pregnancy related plot line, even from like the title card, to even like some of the press about it. So I try to stay in the loop about, what shows are coming out, what shows are people watching, what are the top shows. And because I have a public health background, I also like doing kind of like a big picture. Like I try to get as many of the plot lines about pregnancy and abortion that are on into our database. So part of what we do is we maintain this database of TV shows and movies available to US audiences that have abortion plot lines in them. And for the database, it's just characters who actually have the abortion. So we
mhm,
have movies on there going back to 1916, TV going back to the 60s. So really abortion has been part of the cultural conversation since the beginning of these media forms. But also, we publish these reports every year where we also track, just this past year's abortion depictions. And we include in that characters who talk about having an abortion but end up not having an abortion. So we want to
mhm,
try to see what's happening with characters who consider an abortion. What are their Do they kind of magically become not pregnant by the end? Like, do they have a miscarriage on the way to the clinic? Which is what a lot of, episodes in the 90s did,
mhm,
and we're kind of seeing a resurgence of that. Or are they deciding to carry to term because that's what's right for that character in that decision? So really interesting to track. But yes, it does mean I watch a lot of TV, and I also have a lot of friends and family who watch TV and then will tell me,
Be like, "Oh,
report
did
out
you see
what
this?"
they see. Yes, it's very helpful. I feel like I have a whole, a whole network of people who will text me, and I love recruiting new people to that. So if your listeners want to share with me what they see, please share. I can't possibly watch it all.
Yeah, that's another thing I was gonna say is, like, how do you get the heads up, like, that there's going to be this story, or do you hear it after it's been aired? How does that work?
Yeah, good question. I do a lot of searching, so I have a lot of
Mhm.
Google alerts. I search on IMDb for lots of different
Mm,
keywords. There's different websites that have the scripts of different shows up, so I will search the scripts for different keywords. And also, I don't know, now it's because I've been doing this a while. Lots of people will text me to
mhm,
let me know what they're watching. So it's both an art and a science, I would say.
mhm. I was like, do you have, like, an inn over in Hollywood or no?
No,
No?
no ins.
No ins? Okay, yeah. I myself am a big IMDb person. I am the person that is, like, watching a show or a movie, and I'm like, "I know that person. I gotta IMDb pause. I gotta IMDb" like, that's me. I'm one of those
Totally,
people that has to do
totally.
that. So, one of my favorite sites. Um, so tell me a little bit more about, like, what actually influenced you to, like, get into this type of research? Like, what was one of the influences that really got you into this type of research?
Yeah, it's a good question. Like you, actually started my reproductive health rights and justice career working in a clinic.
Mm,
First at an abortion fund, and then I worked at a clinic in Philadelphia, and as a counselor. And I heard over and over again patients come in with a lot of myths and misinformation about abortion. Right? And they would still want to have their abortions. They would ask me, is the doctor going to use a knife? Am I going to be able to have kids after? Am I going
mhm,
to get cancer? Is this going to be in my permanent medical record? All kinds of things that kind of range from benign myth, like about a medical record, to something that was extremely nefarious, like, are you going to get cancer? And I really wondered where those myths came from, and wanted to understand, what makes someone show up at a clinic thinking that maybe they won't be able to have kids after, but they want their abortion so much that they're there to get it anyway. And I'm
mhm.
so glad that they asked me and trusted me enough to share those fears with me, because I could, you know, debunk them. But it also didn't make it go away, right? So I had this kind of curiosity about the kind of bigger cultural messages around abortion. And I also was working in a clinic when Dr. Tiller was murdered in 2009. So he was a provider of later abortion care in Kansas. And I was both, shocked and devastated, and also just really could not understand where the depth of the hatred for abortion providers in particular, and about abortion in general, stemmed from. So I ended up pursuing a master's degree in public health and really thought I would do public policy work, but those questions about where this comes from really stuck with me. And I ended up doing a lot of work about or related to abortion stigma and trying to understand where our stigmatizing ideas about abortion come from. It really led me to this work on popular culture to try to untangle some of the myths that are in these shows and what people actually take away when they watch these shows.
That's really
Hope that made sense.
that yeah, no, that's really awesome because like you, I did experience those type of questions. And people would come in and yet they were still there. You're right. They're still there because this isn't the right time for them. And they would still ask me a lot of these questions. And, we would sit down and just chat with them and, you know, give them factual information, things that they were reading. Oh, I Googled this. Or some of them were like, I didn't Google anything. And I'm like, maybe that's a good thing that you didn't Google anything because we're going to give you the
Totally,
accurate
yes.
information when you're here. So, I really like how that influenced you because that is true. That I think there was a lot of misconceptions that they have when they can walk in the door, yet they're still there. Or
Exactly right. People want
clinic,
their abortions.
yeah, the people that come in my state, there's a 24-hour waiting period, so they have to come in twice. So they come in the first day, they get all their information, they sign their consents, whatever they need to do, and they still come in 24 hours later. There were not many people who did not show up. Occasionally, yes, there were people that were, but um, you know, very rarely that people didn't show up for that second day because they were so into it, as far as like this is the right choice for me at this time. And I think that's what people
Yeah,
don't understand, is that this is not the right time for me at this time. And now we're facing, not just with the fall of Roe, but now we're facing a whole new aspect of personhood, right? That's the whole new thing about the anti-abortion is people are coming up with the personhood laws that are starting to come out in these states, which not only impacts abortion, but it also impacts the fertility world. I work in IVF, so that affects all of the, IVF people who have embryos and all of that. So I think it would be interesting to because it's all interconnected, right? Reproductive
totally.
health.
Yes.
You can't take away one thing and not affect something else. And I also think that people don't understand that. And I think with the whole Alabama ruling, gosh, was that 2 years ago now? It seems like,
Yeah,
yeah,
unbelievable, right? Yeah.
right? So people were like, "Oh, yeah, man, we didn't realize that." And now people are forgetting again, and I think we need to still continue with that message that, it is reproductive health. It's all interconnected, and that's one of the messages that I would like to definitely see, out there in the media world, not just social media, but, like, TV and movies and things like that, and how it's all interconnected.
Yeah, for sure.
Yeah. So, kind of going back to one of the things that I recently saw a documentary by Soledad O'Brien, I think it's called The Devil is Busy. So that was a very interesting I don't know if you saw that. Did you see that? It was a very interesting take on the security team at a clinic in Atlanta and the protesters and how they bring people in and out. So I thought that was an interesting take on the whole thing because honestly, the security was a big deal at my clinic. I don't know if it was for yours, but that was a big deal. Any little thing, someone's in the parking lot, we had to report it. It was the first job because now they do it at other jobs. It was the first job I had where I had to do like active shooter drills and hide in rooms, things like that. So it's pretty scary out there about things like that.
Yeah, yeah, and I mean, I grew up doing those in school. I went to public
Hmm.
school, and we did those active shooter drills, so that felt familiar to me when working at a
Hmm.
clinic, but it shouldn't be, right? It shouldn't
Hmm.
be that way. It shouldn't be that way.
No. See, I can you can tell I'm a Gen Xer. I didn't go through those drills at all. I didn't have those. I mean, my kids have gone through those, and it's crazy to think that we're accustomed to them like that. That it should never be a way that like, oh, that's just normal. We have to go through that. So for me, that was kind of like a shock. I had never been through one before. So that was really
No,
interesting.
it makes makes sense. No, I mean, it's awful that we have to do it, and also it's, completely necessary, and it's terrible. It's really terrible.
Do
Yeah.
you think like showing like that, like particularly, I think that I don't know how many people watched it or took away from it, but I thought it was interesting, and I think that that kind of storyline would be really good to show. Showing like the backside of things, like how people have to be really careful when they walk in. Yes, there's protesters out there, but I mean, I literally was like looking at the building across the street. I'm looking at just to see if there's anybody on top of the buildings, and like
Right.
that's like crazy. So,
Yeah,
you know,
yeah, I think a lot of shows will show that the kind of aftermath of clinic protests. Like,
mhm,
I'm just thinking, for example, of Grey's Anatomy. They've done quite a few episodes about clinic violence, so is Law and Order. Other shows have also done, many kind of legal procedural shows have done something about clinic violence, especially in the 90s when that was really on the rise. And I think you're right that there really hasn't been, or they'll show kind of a doctor wearing a bulletproof, maybe,
mm,
but there hasn't been kind of from what I remember, like an in depth exploration of an entertainment show, right? Like not a documentary
mhm,
of what providers have to go through. Maybe we've seen a little bit of that from dialogue from different providers on different shows, like even thinking about Dr. Addison from Grey's Anatomy. There's one episode where she talks about the toll it takes, and there's another where a black doctor, Dr. Bailey, receives a lot of harassing phone calls, and her team calls all those people back. So I think there's been some exploration of it, but I think definitely not the day in day out toll it takes on
mhm.
providers and the whole clinic staff. And I think that would really take a show about an abortion clinic to pursue that and have it
Yeah.
not just be kind of like a one-off dialogue.
Yeah, I think it's interesting because it's not just the providers,
No, it's
or
the whole
the
staff.
the
No,
whole
it's the whole
staff, like
staff.
from front
Yeah.
desk, you know, even, you know, I would say billing, insurance, even people
Totally,
doing
everybody.
that, everybody. Um, yeah, so that would be something that I would be on board with, and definitely would like to see that, for sure. So what do you have coming up soon? Do you have any new research coming up? Are you seeing new things? What's new in the whole realm?
Yeah, well, I just published this paper. It's an exploratory study. So we just had 30 people participate. So a small study hoping to do something bigger in the future, where we recruited people who've had abortions and we asked them to watch three different abortion plot lines and to share what they thought, right? Because
Okay.
there's this kind of idea out there that TV and film can change hearts and minds. And our past research has really shown that TV doesn't change people's attitudes about abortion at all. So if you come in anti-abortion, you leave anti-abortion. If you come in pro-choice, you leave pro-choice. But I really wondered if TV could have kind of like a destigmatizing effect. Like if you showed people really compassionate, thoughtful portrayals of abortion, accurate portrayals, would it help them think about their abortion in different ways? And I didn't recruit people who had any particularly positive or negative experiences with abortion. My one of the requirements was just that they had had an abortion in the last 5 years. I mean, it was really interesting how to see how people responded. Unlike me, they did not care as much about all the potential demographic or experiential inaccuracies.
Mm.
People weren't really concerned that the TV shows didn't really depict a lot of the characters facing any barriers to care. They didn't care so much about the type of abortion the characters had, medication or procedural. And what they really cared about was the emotional resonance. So they loved seeing characters supporting each other through their abortions. That really rose to the top for me. And so I've been thinking about that a lot and how to communicate with media, with TV writers, with producers, that the emotional resonance of the show is extremely important, right? Showing that a character is not alone or isolated during her abortion experience, how to make that good TV. So I've been thinking about that a lot and trying to figure out how to communicate that, how to make sure that it's just as important to have the character have emotional support before, during, and after the abortion as it is for the abortion to be medically accurate.
Oh, that's great. That is great. You know what? It just made me think. What about, are there storylines out there about how men react to abortion, or how a partner perhaps responds with,
Yeah, good
either
question.
positively, negative, you know.
Yeah. So over the years, we've seen. I actually have a paper that's under review now about the last 10 years of abortion on TV. And one of the things that I looked at was the depiction of support.
Mhm,
And really, over the last decade, we've seen a rise in shows depicting someone being supportive of the character having an abortion,
mhm,
whether it's a partner, a family member, a friend, a sister, a cousin. I want to say most often it's either a friend or partner, and usually it's a male partner. I want to say we see the support in about a third of the cases, a third of the show. So there's really a lot of room for improvement there.
mhm,
Um, and most often today we see supportive partners, right? We see people who are going with their girlfriend to the clinic, who are helping them afterwards. At the same time, there are still a good deal of shows that have kind of an abusive male partner figure who will either
mhm,
try to coerce their girlfriend into having an abortion or who will just completely abandon her at the
mhm.
pregnancy. And I feel really torn about those. 'Cause on the one hand, those can be, at least the relationship troubles can be kind of realistic. On the other hand, the rate of abortion coercion is so low, at least that we know of, that to me it risks kind of mainstreaming this idea that no one really wants an abortion. Their boyfriend is just forcing them to do it. When obviously that does happen, but it's not something that is so common that I think deserves so much screen time. But I think there's a lot of room for more depth and breadth in men's experiences for sure.
Yeah, in my time at the clinic, I think I saw 1, maybe 2 cases where, when we were talking with the woman separately, she was like, "I don't really wanna do this." And, we said, "Okay, we're stopping. We're stopping. That's it. We're not gonna do this." And the reaction that she was kind of like, not shocked, but I think she was just kind of like, "You mean you're not?" We're like, "No, we're not doing this. You're gonna go home and you're gonna think it through, or you're gonna talk with someone, but we're not doing this today," kind of thing. And I think they were just kind of like, I think for the first time someone was actually listening to them and letting them make that choice, rather than like the partner was like, "No, we're doing this." And she was like, no. So there are very few, I agree, that coercion is happening, but they are still happening. But more and more, I would say no.
Yeah, and I also wonder, like, just hearing you talk makes me think, like, yes, shows should show this, and they should show what happens at the clinic, right? That
Hmm.
if a patient comes in and it seems like her partner is forcing her to do this, that the clinic will actually say no. Like
Hmm.
that's what really those depictions should be about. That the
Yeah.
clinic is providing consent-based care, and that
Yeah.
even if a partner is trying to coerce her, they're not only going to not do the abortion, but they're going to give her resources and support so she can navigate that situation and maybe figure out if that's the right relationship for her.
Yeah. 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 I think they're just taken aback. And I think that's so important. People think when, oh, the abortion clinic, they're just going to do it. No, we're not. We're actually caring about the patient. We're there for them, what they want. And, I would love to see something like that happen. So again, on TV and the movies, that those are things that I would like to see more of, portraying more realistic type of storylines that I saw. Because when I started working there, I was blown away by how, first off, the staff was amazing. Staff with each other was amazing. Staff with patients was amazing. It was very different than I ever expected when I walked in the door. So, and
I
I
think
think
a
I
lot of
think
people feel that way, right? Like research keeps coming out that patients have this perception that their abortion care experience is going to be really subpar because of the myths and misinformation they
Mhm.
have about abortion. And then,
Yeah.
the surveys say over and over that the abortion experience ends up being one of the best healthcare experiences that they've had, right? Where
Mhm.
patients feel the most seen, the most supported, the most cared for. So actually, we should be trying to figure out how to make other areas of medicine more like abortion care.
Mhm. Yeah. Absolutely. It was a very caring environment. Just nothing was rushed. Everything was just kind of ran kind of smoothly. And, I would love to see that in other healthcare areas for sure, that don't get rushed through. Oh, you get like 2 seconds with the doctor and okay, bye. It's not like that at all. It's very, um,
For sure. I mean, and not to say all
is
clinics are perfect, but just,
right.
that's been the experience of so many
Yeah.
people, right?
But from our experiences that we've had, that is the way it has been.
Yes, right.
So, all right. Well, we're coming up, toward the end of our time here. So we're gonna go ahead and talk to our audience. We want to hear from the audience. What are your experiences and what do you feel should be portrayed more on TV and in films? And ask questions, and we can ask Steph and we can invite her back in the future, or we could connect in some way and answer those questions.